All right, so we've plugged the damage, so that's the first step to healing. But now how do we actually pull the ends together and make sure that healing actually occurs? In other words, how do we repair a blood vessel? So platelets, not only do they help form these fibrin threads, but they will actually pull on those threads, causing the clot to retract and pull the two ends of the damage together. And then those fibroblasts and endothelial cells will help repair the blood vessel. Now, it's also important that we control clotting, because when we have uncontrolled clotting, we can have things like strokes happening or heart attacks happening. So it's important that we can control, and we only have clotting happen where we want it to. Often what we see, and you're seeing in these images where there's plaque buildup in the walls of the blood vessel, blood flow is reduced, or those platelets see this as damage, and they'll start forming a plug and then a clot. Okay, but in general, to make sure that we do not form clots inappropriately, we have something called the fibrinolytic system. So whenever you say lytic, it means it's breaking things down. So it's simply the system that breaks down fibrin. So you can see fibrinolysis is simply, this is just a definition, is a dissolution or the breaking down of a clot. Inactive plasminogen, so there's another O-gen that you're seeing here. So here's another protein that is incorporated into the blood clot. Once we form factor 12 and thrombin, it activates. Plasminogen, so that O-gen, we just knock off that O-gen, becomes plasmin. Fibrinolysin is its other name because it's going to break down fibrin threads. Either term is okay, just be aware that it does have multiple terms that it's called. Basically between this plasminogen and the active plasmin kind of breaking down threads as they are being formed prevents them from just spreading. So if you know this, if you cut yourself, the clot forms right there. You don't have it suddenly spreading across, like, let's say the back of your hand. If you cut the back of your hand, that would be horrible, right? Nor do you have it growing up the blood vessel where the damage is. Again, that would be terrible. Part of what also helps keep clotting at bay is simply the flow of blood, because flow doesn't stop, right? It's not like there's a complete blockage, unlike how they repair our highways around here. Flow keeps going as repair is being made. So just by the flow of blood, as you're moving further away from the site of damage, the factors that would induce a blood clot to occur are diluted by the blood flow. So that also helps. All of these things allow or what factor into a clot remaining localized. So again, just at the site of damage. There are also cells in the blood called mast cells. These have, or these produce, I should say, anticoagulants, so factors that prevent blood clotting to also occur. Okay, so what can go wrong? Well, as we just mentioned, we can have an inappropriate blood clot form. The difference between a thrombosis or a thrombus and an embolus is whether or not it is moving. So basically, a thrombus is an unbroken, is a clot that is formed in an unbroken blood vessel. Again, if that inner lining is somehow seen as damaged, like due to plaque buildup, or if blood flow is too slow, it can cause coagulation to occur. When it dislodges, so as you can see in this image, here's a thrombus. If it dislodges, it's starting to travel. It is now an embolus. So that's a clot, an air bubble. Sometimes it may even be fat in the blood that can now travel, and this is where it gets damaged because it may travel to smaller blood vessels, or it can then basically either completely block the flow of blood to an area or just simply cause major damage in those small blood vessels. You probably have heard of people being told to take aspirin to prevent blood clots. So that prevents that thromboxane A2. And if you remember, thromboxane A2 helps prevent, thromboxane A2 causes platelet aggregation and vasoconstriction. So by blocking thromboxane A2, it prevents platelet aggregation from happening. So it prevents clots from forming. Again, if we don't prevent that, that can lead to strokes, transient ischemic attacks, and myocardial infarctions, so heart attacks. There are other anticoagulants out there. So there's heparin, warfarin, or Coumadin. You may be familiar with some of these. These are administered a lot of times during surgery or post-surgery. Many of them are going to block vitamin K. So again, if you remember from a few slides ago, vitamin K is going to be necessary for the formation of certain factors. So again, if we don't have those, the clotting cascade cannot continue and it stops before it can ever form fibrant threads. Blood that is stored in blood banks is treated with citrate phosphate dextrose. You may have seen as CPD, which removes calcium. So again, no calcium. If that's needed every step of the cascade, that means the cascade cannot continue, which means a clot cannot form. Sometimes thrombolytic agents are injected to dissolve blood clots. And these either will directly or indirectly activate that plasminogen, forming plasmin, dissolving blood clots. You may have heard of people being hemophiliacs or hemophilia. This is an inherited deficiency of clotting factors, and depending on which ones you are missing or if they're just damaged, hemophilia can have various stages. It isn't just an all or nothing kind of thing. But because there's usually some sort of damage to one or more of the clotting factors, again, that prevents proper blood clots from forming. So this means that bleeding may occur spontaneously after a minor trauma. So things that you might normally form a small bruise, you may see a very large uncontrolled bleeding occurring subcutaneously. Things like nosebleeds, blood in the urine, all these other kinds of things, because again, blood is not clotting properly. Treatment for it is transfusions of fresh plasma or concentrations of whatever that missing factor is. So they would have to blood type the individual and do some analysis to see where exactly the deficiency is. The exact opposite of hemophilia is something called disseminated intravascular clotting. So normally, again, blood clotting stays localized in people who have DIC. The proteins are abnormally active throughout the body, and they may just start spontaneously forming blood clots. And that's what you're seeing. And what you're seeing here are actually mice, so this is not a person. But this is your normal, and this is a mouse that has this disseminated intravascular clotting gene. You can see how pale the mouse's liver is, and you can see like these are the intestines. This is where the clotting has occurred, is in this area. Similarly, you can see the clots forming in the intestines, heart, lung, liver, kidneys, and even in the brain. So very bad. Okay, that's it for platelets and blood. If you have any questions, feel free to email me.